welcome to the GR8 Minds podcast with me, David Pugh.
And me, Lucy Owens.
And today we're joined by Olivia Utley, who is our guest from Kooth.com, who's going to tell us all about the organisation and what they do to support young people. So we're looking forward to hearing about that, and thanks for coming along, Olivia.
No problem.
Okay, so I was going to say I've got loads of questions about Kooth, and it's probably one of the things that I signpost young people to most in terms of any support for mental health and well-being. But I see that Kooth has grown to be the largest digital mental health provider. Can you just tell us a little bit about Kooth and anyone who might not have heard of Kooth.com and what it is?
Absolutely. So Kooth is, like you said, we're the largest online provider of mental health support and counselling for children and young people in the country. We've been commissioned, so Kooth itself is a public limited company, which is a fancy way of saying that we're on the stock market. We have opportunities for people to invest in the company, which means that we kind of have the resources to meet the demand of our service as it kind of has rapidly grown. So it became a public limited company. Funnily enough, when I started 2 years ago, around September 2020, which was a very strange time. We were very midst pandemic still.
Yeah.
But I think that because we were so thick in the throes of the pandemic and we were so physically disconnected from each other, what we needed more than ever was a place to connect digitally, but in a very safe way, and that's exactly what Kooth provides. So we're a free online website. It's accessible to anyone who is in a particular age range in a particular area. So the reason why it's slightly different in different areas, so in Bradford, for example, it's available for 10 to 18-year-olds, because in Bradford, the service is being paid for by the NHS Clinical Commissioning Group. Mm-hmm. So they commission the service from us and we provide it to everyone living in that local authority. And that's kind of what my job is. I'm an engagement lead for the service in Leeds and Bradford, so it's my job to kind of get the word out there and make sure that everyone understands Kooth and how they can benefit from it. But if you're in Newcastle, for example, then I believe your offer is 11 to 25. So as long as you're in the age range of your local area and your local area has Kooth, and 97% of local authorities in the country have it. So you're most likely going to have it in your town, in your city. But as long as you're in those age ranges, you are eligible to sign yourself up anonymously for free same-day mental health support and counselling. There's no criteria, there's no thresholds, there's no waiting lists. So anybody, whether it's just low-level preventative, you're having a bad day and you need to sound off to someone and get a bit of advice, please come and chat to us. It could be that your mental health is on fire, there's a huge crisis, you're in crisis, and you can come to us as well. So we're trying to remove as many barriers as possible for children and people to access mental health support, basically.
Fantastic. And yeah, I think that's one of the things that I like. I don't know about you, Lucy, but I think that I find that because it's got such a broad range, with it doesn't matter whether it's very low level.
Yeah.
You don't need to be, at crisis point or anything like that. It can just be I'm feeling a bit rubbish because I've had a bad day at school or whatever it might be, or I just had a bit of an argument with mum or sister or friend, and that can be all it is. And they might be fantastic again within a few hours, and everything's back. No, but you can go on to Kooth and use it for that. Absolutely. Or it can be for for anyone else who's been struggling much more longer term and so on. So,
yeah, I think I'm in agreement with you as well, David, and I know when I've spoke to young people and signposted them to Kooth, obviously you've got the variety of options where you said there's someone on hand to speak to.
Yeah.
I know there's blogs and forums where they can offer like peer support, and that's really good to know that for that young person especially, that they're not on their own, that there's other people out there who possibly are feeling the same, and they might pop on there and see a comment from someone else and think, do you know what, that's how I feel, and if they've come up with a solution to support them, you know, that young person might take that on board and try it themselves. So it's really good that there's different avenues to go down, really.
You're 100% right. I mean, we're an online community. We're about bringing people together, and that can look a million different ways. There's no wrong or right way to use the website. So it might be that you're looking for that professional counselling, and we are BACP accredited, which is the British Association of Counselling and Psychotherapy. So it could be that you're looking for that really professional experience counselling, or it could be that you want to log in, like you mentioned, just to go on the forums and just to get that support from your peers. There's activities on there. We have a podcast, we have playlists, we have a mood tracking journal, we have a goal setting tool. So it's basically a community, an online hub of so many different resources and tools to support your mental health and well-being, and there's no wrong or right way to use those tools. Our podcast, which is Kooth, if you look up Kooth podcasts on Google, Apple Music or Spotify, then you can find all of our range of podcasts aimed at children and young people around mental health and well-being.
And I know when we've mentioned as well, Olivia, to the young people that it's kind of anonymous, so although they sign up to the platform, that they are then anonymised, so if they was to write out or reach out to somebody, how do you go in terms of managing that? So obviously if you highlight that a young person's in real crisis, obviously where do you go from there? I don't know how.
It's a really good question. So there's a couple things I guess to address there, but the biggest is that we do have a safeguarding team, so you can always get in touch with them with concerns and questions. Their email's just safeguarding@kooth.com, but we have a really robust kind of clinical governance in place. We have a clinical team, we have research teams, we have data teams, we have safeguarding teams, we have our practitioner team. So as well as kind of as accredited and supported and experienced as all of the online team are who give that chat, they're also really supported when safeguarding concerns come up and where we do think someone's in crisis but we don't have that personal information about them. So the way it works is when you sign up on Kooth.com, it takes literally less than 2 minutes. I feel like I'm doing a sales pitch here, but it really is like, it's too good to believe, and I work for the company. I'm still waiting for like, where's the catch? Because it's just removed so many barriers. But it takes 2 minutes. You give your gender identity, your ethnicity, a rough location of where you are. You don't have to give any specifics, and you certainly have to provide an address. You don't have to provide your name, nothing identifiable or personal, and then just the year and month that you were born. So you answer 4 questions that aren't specific to you. You do create your own username, and we ask you not to put personal information in that username because it can be seen by other people. Once you're on the site and you're paired up with a counsellor, you absolutely can share personal details. We'd never discourage that, but giving us your personal information is not a requirement of accessing the service. So for us, what we know from our data, because we do have such a robust kind of data team in place, and we do so much around kind of like clinical insights and clinical governance, we know that a bigger protective factor for children and young people is having access to this kind of really easy access support from Kooth, as opposed to having that identifiable information. Because what we know around data around death by suicide, for example, the majority of people who die by suicide are known to a service. So their name, their address, the fact they're having suicidal ideation or intent, for whatever reason, and I get goosebumps when I talk about this, it's much too tragic for me to even begin to go into, but for whatever reason, having that personal information about that user has not been a big enough of a protective factor, and that person is no longer here with us. So we understand traditional safeguarding, and if we have personal information, all the traditional safeguarding protocols apply. But if we don't have personal information, there are so many ways that we can keep children and people safe. We'll do welfare checks on them, we'll de-escalate the situation while they're still in chat and give them crisis information, bring them back in for chat the following morning. And what we see over time is that users build up their confidence and their trust in us to be able to kind of do the right thing and handle that personal information about them sensitively in a way that's not going to impact them.
Yeah, definitely.
So there's over 500 people that make up Kooth. It is a very well-oiled machine, and when you're on forums with children and young people, when they're kind of sharing personal advice or experiences or stories, it's all pre-moderated. So anything you share that's personal to you is your journal, your chat sessions, your goals. That's private to you and the Kooth team. No one can see that, so that's why you can share that personal information. Outside of that, we have the forums, the articles, all of the what we call the community, and that's all pre-moderated. So anything that you submit to the community has to be approved by our clinical team before anyone can see it on the site. So if you're a child or a young person looking around Kooth and you've seen all these amazing articles and you've seen all these supportive comments, you can only see them because they've passed that moderation. So we 1000% guarantee you cannot share personal details, you cannot receive someone's personal details, you cannot be bullied, trolled, groomed, harassed, judged. So in a way, it's kind of like a perfect utopia when you log on and you just see this like beautiful, supportive community. But there's a reason why it's that way, sort of thing.
I think that's really good, and I think that'll hopefully offer reassurance to the young people and also to parents, because obviously we get asked questions around, you know, is it safe, and if things are disclosed, how the support's there. And to be honest, Olivia, I've learnt a lot more about Kooth just in this session that we've had now, of knowing that there's, you know, that they can access that support from a professional, but they have those follow-ups as well, because I think with some young people, they need that continuity and, you know, making sure that they feel back into a stable position. It's not kind of that they picked up and then the signposted to something and dropped and left and forgotten about. There's that continuity of involvement with someone, so that's really good.
I think that's great, and like Lucy says here and said there, I think a lot of young people and parents, then that is a concern that sometimes, particularly when you go online and you can be looking for support and you go onto the wrong forum and people are going to be giving negative comments, trolling, bad advice and so on.
Or it's dangerous. Online can be a really dangerous place, especially for children and young people that maybe, I mean, it's dangerous for adults, but it's really dangerous when you're at that vulnerable age and you're searching for your identity, and amongst all of that, you know, your mental health might not be as healthy as you would like it to be. So I think one of the biggest things that Kooth can offer, apart from being accredited and safe and easily accessed, is we're safe, we're very, very safe.
Fantastic. Okay. In terms of what you're seeing with young people at the moment, is there any particular issue that you think is sort of the hot topic in mental health and well-being? I know we probably see certain things coming up and maybe different trends at different times, but I don't know, what would you say is the main thing that's coming up at the moment?
Well, the amazing thing about Kooth is we have a really specific breakdown of, we have a national picture of what are the kind of more emerging issues, but we also have a really specific breakdown of regionally and locally. So you can even pinpoint in a particular town what are the most highest presenting issues for our users. But I would say across the board, we're seeing from our data such a high rise in suicidal thoughts and self-harm, self-injury. And that's from data, but also anecdotally on the ground. So a big part of my job is presenting to children and people around the Kooth service, around managing your stress and anxiety. And I hear from teachers when they greet me at school of, you know, we're so thankful you're here, because our entire female population of our year 6 group is self-harming at the moment, and we've never known anything like it. And you think back to just how young you are in year 6. I mean, you're 10, 11, that's so early on in your childhood, and to feel the pressure so much so, or to have your mental health impacted so much so that you resort to self-injury at such a young age is just heartbreaking. And that's not to say there's not been a pressure on young ages throughout the entirety of history, that absolutely has, but I don't think anyone can deny the role in kind of the pandemic and social media. It's just a different pressure that children and young people are facing. And if you don't have the tools or the awareness, or it's new, the pandemic was unprecedented, we didn't have the tools and the awareness to know how to deal with it. And I feel like that's what children and people are going through now with the mental health, is it's a different set of things that are affecting their mental health to what maybe we grew up kind of navigating. And not that we had any better of an idea and we had the tools, but at least we could maybe have an idea of from our parents, oh, well, this is not how you deal with bullying in school, but how do you advise children and young people to, navigate social media when it's brand new to all of us and we don't have the advice to give them?
Yeah.
So I think we're seeing, unfortunately, and with young boys and again, this is nothing new. We're all, you know, well, especially in the mental health space, we're keenly aware that males don't access mental health support. You know, even it's so the disparity between males accessing mental health support and females is huge. But we know that the biggest killer of men in this country under 45 is suicide. So we're seeing that need for young males and males to access the mental health support, but due to kind of like the stigma around it, they're not accessing, and it's having horrific, tragic consequences. So yeah, it's suicidal thoughts and self-harm are definitely scarily on the rise, what we see at Kooth.
Okay. And so linking into that a little bit, then do you have any sort of top tips or advice for any young person who was feeling like that? So whether it be a young boy who is feeling a little bit worried and maybe a little bit embarrassed about speaking to somebody, or it might be a young girl who is self-harming. Do you have any tips and advice for them?
Yeah, I mean, it seems really simple, but speak out and just find some comfort in that statistically you are probably not the only person who's felt that way and who's had that experience. And while nobody knows what it's like to live life in your shoes, somebody might relate to an aspect of what it's like to live life in your shoes. And I think when something's affecting your mental health and well-being, it's so easy to become very quickly isolated and feel like nobody understands this, I can't talk to anyone, and it just gets heavier and heavier and heavier, and the light at the end of the tunnel seems further away and dimmer. And I think that's the beauty. Again, not to kind of like push Kooth, you can reach out to someone at school, you can reach out to someone at your GPs, at a local service, just speak to a trusted person. And it's that classic thing, isn't it, of a problem shared is a problem halved. But for me, half the battle is just finding the confidence to speak out, because that is just a massive obstacle in and of itself. And Kooth's whole kind of tagline is "you're never alone," and that's why we want to provide this really easily accessible online space so that you can see very quickly, oh, there are tens of thousands of children and people that are my peers that feel that exact way around exam stress, or oh, I'm so glad that they're struggling with revision as much as I am because I thought it was just me, kind of thing. And I think for young males and marginalised groups who have a much harder time accessing healthcare, just knowing that there are services out there that are committed to combating those barriers for you, and it might not be perfect, but there really are people trying very, very hard. And something I always include in my presentations are examples of cisgender males who have been really open about their mental health struggles. So we talk about like Stormzy or Freddie Flintoff, or I'm trying to think of all the males in my slides now, like Kid Cudi, like just different rappers, and I always forget his name. Tyson Fury, who really, really famous, especially after his huge win a couple months ago, and is a really kind of signifies a lot of like traditional masculinity, and I think he's just a really good example that if you come from a background that is really pushing that message of traditional masculinity and man up and grow a pair, and you're basically being taught, like I always say to children and people, having emotions is part and parcel of being a human being. So if you're a human being, you have emotions. That's just fact. There's no kind of, we can't, talk around that. That is what it is. And if you're receiving messaging of man up, don't cry, X, Y, Z, you're basically being encouraged not to be a human. And I always say to young males how unfair that is, and try and look to these examples of males who have spoke about it and have tried to bring down the stigma, because the more we speak up and speak out about our experiences, the more help we're going to get, and the more tools and resources, and the better hopefully we're going to feel in future. But also we combat a wider social issue of just removing that stigma around mental health and getting support.
Yeah, no, that's really good. Thank you, Olivia. And like with myself and David's role, where exactly much like your tagline that you're not alone. You know, we've probably worked with a lot of young people that have had similar things going on, and you know, we've been able to offer that support to them. And at the end of the day, like you said, the first barrier is just that the initial step of opening up to whoever you feel trusted to open up to. I appreciate you've got to feel that you can build up a rapport with that person, but then just making that initial step, and then you know, having that support and some sort of self-help resources and things to explore, to start to make yourself feel better. But it sounds really good that you're going to schools and that you're having an impact there as well, because we work closely with schools as well, don't we? And we know the impact that you know, all these services that are out there are expressing the same message. They might be delivering it in different ways, but it's just showing that you know, there is that support out there, and just to reach out, really.
Definitely.
And I think that's quite important, because I think, you know, sometimes I'll meet young people and we might not see a young person in school, we might see them in the GPs, or they might not want to go into the GPs and prefer it in school. Whatever it is, then even if, you know, you don't want things to work in a certain way, you don't want to open up, it might be that you don't even want to speak about things verbally, then there is support out there for you. You can go on Kooth, you can go online, and you know, you don't have to have a face-to-face appointment with somebody. You can have that anonymous chat and still discuss your emotions and feelings. And obviously, anybody who does want the face-to-face appointments, then they're available with us too. But I think it's good that we've got those different services. So if anyone is listening and needs that little bit of support, then be aware of it and just go on Kooth, and that's KOOTH.com. I always get asked about that, but no, I know it's really useful for a lot of young people.
Yeah, absolutely. And thank you for reinforcing that it is Kooth.com. I think oftentimes we get referred to as an app, or people say in school, go download the Kooth app. The reason we're not an app is because to download, I've just said app like 5 times in the same sentence, but to download an app you need to be logged into an account, and that account has your email address, your name, it has personal information about you. So when you download an app, we know who's downloaded it, we know where you are, we know who's using it, and that would totally breach our anonymity. And it is a promise, we don't store an IP address, we totally take you at your word of where you've signed up, we have no way of verifying it. So it's about going onto the website, and we're not an app because we'd have to waive that anonymity, which is something that we don't want to do and our young people don't want us to do. So yes, Kooth.com, and like you mentioned as well, there's no it's all text-based support on Kooth, so you don't have to ring anyone, you don't have to phone anyone. You can sign up without anyone knowing, you don't have to tell anyone at home, you don't have to tell any of your friends, no one in school has to know. So just really secure and anonymous and safe.
Brilliant. Thank you for joining us today. I don't think we've got any more questions.
No, I think that's really good. Hopefully.
I talk a lot and I talk fast, so
I think it's been brilliant and covered loads of things. So hopefully that's been some great support for anyone out there who's listening to it. So thanks for coming then, Olivia. It's been great to hear all about Kooth and how it supports young people and the great work that you're doing there, and just keep up the good work with it all.
Thank you. Likewise, thank you for having us. We just need more people having more conversations like we have today, so thank you for inviting me.
No, thank you.
Thanks for listening to this week's episode of the GR8 Minds podcast. If you have any questions that you would like us to answer on the show, please get in touch via our Instagram page at the GR8 Minds podcast, and we'll do our best to answer your question the next time we record. If you would like to find out more about GR8 Minds and WACA, please visit our website www.greatminds.co.uk. Until next time, you've been listening to the GR8 Minds podcast. Speak soon.